Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon and Gynecologist working here at Vriksh Fertility, HSR Layout, Bengaluru. So understanding the root cause of infertility is very important to plan a proper treatment and to guide the couple easily towards the journey of parenthood. So firstly, to break down this part of how do we evaluate an infertile couple, let us first come to the definition of what is infertility. A couple, if they are married for about a year and they are trying to have a baby without using any form of contraception, then they have to come and meet a fertility specialist if the woman's age is below 35 years. If the woman's age is more than 35 years of age, they have to come and meet the doctor immediately, or at least 6 months of trying for pregnancy without using contraception, or if any kind of medical condition is present like diabetes, asthma, epilepsy or any disorder, they have to approach the doctor immediately before planning for pregnancy itself. So once a couple reaches a fertility specialist, we break down the evaluation into male partner evaluation and female partner evaluation. So male partner evaluation, normally we start with detailed history taking, wherein we ask about the medical history, the previous surgical history, any history of habits and sexual history, any STD testing history, or any childhood history wherein they have a history of fall or infections, etc. And also we find out whether they are on any medications, already they are taking any medications. Apart from the history taking, the cornerstone main part for male fertility evaluation is the semen analysis test, which is the first basic test which we advise for a male partner. So this semen analysis testing is preferably asked to be done in a fertility center so that it can be assessed by an andrologist. That is the person who studies the sperm and gives us a report, mainly for which we check for count, motility of the sperms, the morphology, that means the shape of the sperm, and if there is any infection present or not. These important points can be made out only based on one test, which is the semen analysis test, which we usually ask them to give with an abstinence of around 3 to 5 days. Now, after this, we also equally stress upon getting a health check done, which includes basic health evaluation like your hemoglobin, thyroid, sugar, etc. are checked on the same day. If any of this test comes abnormal, or if the semen analysis test is found to be abnormal, like the count is on the lower side or motility is on the lower side, then we advise for further testing. Like we ask them to get a ultrasound done of the scrotum and Doppler to rule out conditions like hydrocele, varicocele, etc. And we may also ask them to get certain blood tests to check the hormonal levels in order to check whether the production of sperms is happening in the testis or not. Now coming to the female partner. The female partner, similar, a detailed history is taken, which includes the medical, surgical, sexual history, past history and the present medication history or any drug allergy history. And the previous records, if anything, medical records, if they already have, they are checked. Apart from this, we ask the female to get an ultrasound done. Preferably, a transvaginal ultrasound is done to check the uterus and the ovaries on both the sides. Uterus, we normally check if there is any abnormality in the shape of the uterus. If there are two uteruses, or if any septum is there in between, or if any fibroids or any other abnormalities are there in the uterus. Ovaries, we normally check for something called as antral follicular count, wherein we check small follicles, how many are there and how they are, and also to rule out any other forms of cyst, ovarian cyst like endometriosis or complex cyst or dermoid cyst, etc. Once this baseline scan is done, we also ask them to get certain blood tests done, like the routine hemoglobin, thyroid, sugar, but at the same time your fertility doctor may ask you to get a blood test called AMH, which is the anti-Mullerian hormone, which tells us an idea about your ovarian reserve. So ovarian reserve is basically understood by your ultrasound, which is the antral follicular count, plus this AMH, and also a test called FSH, which is usually done during your second or third day of the period. So these tests which we have done, the basic test for the male and the female partner, will give us an idea as to how to go ahead with the fertility treatment planning. Should we ask them to try naturally for few months, or should we ask them to start with the fertility treatment with a basic treatment like IUI, which is intrauterine insemination, or should we ask them to go for IVF? That will completely depend on these basic tests which are to be done. National Infertility Awareness Week, it is mainly there to help educate and promote awareness with regards to infertility. Now we all know that infertility is a very emotional journey when it comes to any couple. Can we do something from our side to help in such conditions, be it for our own relatives or neighbors or anyone? Yes, I think we all as a society can build up emotional support towards them. Be careful with what you talk to them and the questions you pose and the advice you give them. We never know what they are going through. Make them understand that you are available with them if they ever require any form of emotional support, and at the same time that they also have certain support groups, professionals available to help them support emotionally and also financially if required.